One woman that I just spoke to yesterday had a stack about 4 inches high of bills that she had from the emergency room. She had had all these symptoms. She had no doctor. She had no insurance. And so she would try to go without care until it was so bad she couldn't stand it and she'd go to the emergency room. Now that she has insurance, she's gone and gotten evaluated and some testing, and they found a tumor on her pituitary gland, and that this had been causing her symptoms all this time. So had they removed that, she wouldn't have a 4-inch stack of bills, but she couldn't afford to get that kind of care before without insurance. So this is a person that's going to go and get care and be treated and hopefully recover, relatively quickly. So we're getting a lot of people like that who've been unable to afford insurance. They often work. This woman works, just was not offered insurance on her job. So, and they're crying sometimes, they finally get that insurance. They're getting the financial help. This one was paying $20 a month for her policy. And, it brings tears of joy to them.
How do you separate all the political noise from this issue when you're trying to help folks enroll?
It's actually pretty easy because when you need health insurance, and I start talking to you about, you go to this website, you press this button that says apply here, you put in your name, you need to have your social security number, it's very concrete and basic. The issues around where it really becomes difficult is when someone comes to you and their income is so low that they don't qualify for any help in North Carolina because we did not expand Medicaid. The federal law was written in a way so that the lowest income people would get Medicaid. So anyone under poverty level is not getting help from this, and they're exempt from the fine. I encourage them all to go check the website anyway to make sure that they're exempt, and that will also put in their exemption to the IRS so they don't get fined or anything. So I think in that case, it's very difficult where the poorest people in the room that you're talking to might not qualify for help and still will go uninsured.
There are some people who, through this process, find out they're eligible for Medicaid, right? And under the current law. Yes,
or their children might qualify for health choice. And those people can apply at healthcare.gov, or they can go, once they see on the website that they might be eligible for Medicaid or their child for health choice, they can go to their social services directly and apply either way.